Okay, let's talk about the somatic nervous system. And as we do, we're going to answer a couple questions. What is the role of the somatic nervous system, and where are the cell bodies of the somatic nervous system located? As a review, you'll remember we have two functional divisions of the nervous system, a somatic nervous system and then the autonomic nervous system. The autonomic nervous system is responsible for innervating smooth muscle of organs and blood vessels, as well as doing sensory there. But what does the somatic nervous system do? So the somatic nervous system is responsible for motor innervation of skeletal muscle. That is voluntary things we control, like kicking a soccer ball, going for a run. And then sensory innervation, the somatic nervous system does sensory to the skin with specifically pain, temperature, touch, and pressure. It also does sensory innervation to muscles, tendons, and joints with pain and proprioception. And again, proprioception is that really cool sense of being aware of how and where your body is moving in space. Finally, the somatic nervous system has a couple different types of nerve fibers. There's the somatic motor fibers, which are efferent or exiting the spinal cord. And then there's the general sensory fibers, which are afferent or arriving at the spinal cord. And we want to know, where are the cell bodies located with these two different types of fibers? And to find that out, we are going to do a couple of nerve traces. And since we all live in Utah, I know we're huge Utah Jazz fans, so this first nerve trace is going to take place at a Jazz game. So while at a Jazz game, a friend puts a piece of ice on the back of your neck. You quickly brush it off with your right hand. So let's trace this nervous pathway that is occurring while you're watching the Jazz get a big win. So to do this, we're going to use this image here. You can see we have a spinal cord segment kind of representing the C1 to C8 region, and then as well another one representing T1 to L2. And then we also have these target boxes representing areas of the body where these nerve fibers can be going. So in our scenario, we have this general sensory afferent input from the posterior neck, and then we have this somatic motor efferent output to the right upper limb. And in doing this trace, I'm going to start with light blue to represent the general sensory fibers, and that is going to start in the left posterior neck. And in reality, it could start on either side. I'm just going to start with the left. So this light blue sensory fiber is going to start in the posterior neck, go through the dorsal ramus, the spinal nerve trunk, and then the dorsal root. And you'll remember these are pseudo-unipolar neurons, so we're going to have a cell body in the dorsal root ganglion. And then we're going to synapse in the posterior horn gray matter with a pink interneuron. This is a multipolar neuron, so I'm going to draw the cell body. And you can see that is then going to go and synapse with a multipolar somatic motor neuron in the anterior horn of the spinal cord. And then the axon from the motor neuron is going to run through the ventral root, the spinal nerve trunk, and then the ventral ramus to eventually get to the right upper limb so we can brush off that cold piece of ice. And that is our first nerve trace. So we're going to do one more here. You can see we've got this beautiful picture of a dog in the woods that's being walked. What could possibly go wrong? Well, this is what's going to go wrong. So your right toe catches on a rock while walking your dog. You immediately throw both arms in front of yourself to prevent a total face plant. Again, we're going to use a similar image. We've just added an L3 to S1 segment, so we have an area where we can get some lower limb input. And in this scenario, we have that afferent general sensory input from the right lower limb, and then we have the somatic motor output to both the right and left upper limbs. Similar to last time, I'm going to use light blue to represent the pseudo-unipolar sensory neuron. So that's coming from the right lower limb through the ventral ramus, then the spinal nerve trunk, through the dorsal root. And again, we've got the cell body in the dorsal root ganglion. And then we're synapsing with an interneuron in the posterior horn of the spinal cord. And then this interneuron is going to ascend through white matter tracts to get to the C1 to C8 levels to be able to then reach the upper limbs. And there are specific white matter tracts that you're going to learn in neuroanatomy, but here we're not going to be super specific or picky about that. So our interneuron ascends through the white matter, and then once we get to the C1 to C8 level, you see the interneuron splits, and we're going to synapse with another interneuron so we can cross to the other side. And then on the right side, we synapse with the cell body of a somatic motor neuron that can then run through the ventral root, spinal nerve trunk, and ventral ramus to get to the right upper limb. And then on the left side, we're again synapsing with the cell body of the somatic motor neuron that also runs through the ventral root, spinal nerve trunk, and then ventral ramus. So now we've got both upper limbs out in front of us, and hopefully we've prevented that embarrassing face plant. I don't know if anybody would even be there to see it in the woods, but we still don't want it to happen. And those are our two nerve traces. So let's do a recap. With the somatic nervous system, we learned that it is responsible for motor innervation to skeletal muscle, or things that we can control, as well as sensory innervation to skin, muscles, tendons, and joints. And then we learned that the somatic nervous system cell bodies for somatic motor fibers are located in the anterior horn of the spinal cord, and then the cell bodies of general sensory fibers are located in the dorsal root ganglion. And that is the somatic nervous system.